Hi, Chantal. Yeah, so anyone who wants to change their body is perfectly able to. Regarding breast augmentation specifically, most women in their early 20s know whether they like their breasts or not. They know whether their breasts are big enough, shaped the way they want, whether they're asymmetric. So most women who want breast augmentation ask for it at about in their early 20s, okay? Then there's a second group of women who, after having babies, find that the breastfeeding caused all their breasts to deflate, and they're left with what they call teabag breasts. So these women then come for an augmentation, which is often combined with a lift to reposition the nipple correctly and give you a nice aesthetic. So there are no real rules to it. It's just a personal need. Okay, so breast augmentation is the second most popular plastic surgery procedure worldwide, okay? But it has the highest litigation worldwide. And this is because of poor patient selection, improper matching, or just not listening to the patient's desires. So what you have to do is see the surgeon, you have to be assessed. Otherwise, you might find that, just putting implants in makes the differences more apparent. So it's always really about just making sure that you've matched the people correctly. That done correctly, breast augmentation patients are some of my happiest clients. Done incorrectly, like I said, it's got the highest litigation in the world. Yes, thank you for that question. Okay, so let's first talk about the difference between using fat or using implants. Okay, so the fat sounds like a really good idea because it's soft and it's natural. But in practice, it often has a lot of complications where it forms little cysts. It can be quite granular in the breast. So for me, in my practice, and I think a lot of surgeons internationally as well, we are finding that we much prefer implants, okay? And then in terms of implant selection, different surgeons use different methods. Some use 3D imagery, 3D generated imagery to show you what the different sizes would look like. I myself prefer to use an actual sizing kit where we would put on a bra and try out different implant sizes in the bra. And in this way, we take a series of pictures and then the patient gets to choose. In terms of the actual final judgment, because the patient is asleep, I have to make that final choice, but I always try and make sure that my patient and I are in the same range, So if we have agreed to put in about a 350cc implant, I'm not going to wake up, you're not going to wake up with, Dolly Parton boobs or anything. Okay, so in terms of preparing for surgery, and specifically for breast implants, the number one rule must be do not smoke. Smoking will make the wound open and expose the implant after surgery, in which point it has to be taken out. So do not smoke. That is the number one rule for breast implant surgery. Other than that, the general rules apply. Eat a healthy diet, avoid alcohol for a week before the surgery, and stop the supplements. Stop supplements 2 weeks before surgery. They will make you bleed more, and in the case of breast implants, they will increase the chance of you forming a hard capsule around the implant and developing something called capsular contracture. So in terms of prepping, that's what I would suggest.